Good afternoon and welcome. Today's webinar, presented by Provider Relations and Care Management of ACA-NY and LIFEPlan CCO, will be covering the role of the care manager in incident management, as well as updates about the CCOs. My name is Angie Monroe, and I'm the Director of Provider Relations for Long Island. Our presenters today are Karen Hoffman, Director of Provider Relations at LIFEPlan CCO, Fran Berman, LIFEPlan CCO's VP of Care Management for Greater Mohawk Valley and the North Country, and Nicole Richardson, ACA-NY's VP of Care Management for Brooklyn and Queens. We thank you all for joining us today, and we hope you can take away an understanding of our incident management process that will enhance our collaborative work. To ensure sound quality throughout the presentation, all attendees are muted without the ability to unmute. If you're having difficulty with your audio, please notify us in the chat box and you will be assisted. We welcome and encourage you to ask questions about today's presentation. Please submit your question using the chat box and we will answer as many as time allows at the end of the webinar. The questions that are not answered will be included with recording of today's presentation on the Provider Relations page of both LIFEPlan's and ACA-NY's websites. To begin, it is my pleasure to introduce Karen Hoffman, LIFEPlan CCO's Director of Provider Relations for the Greater Mohawk Valley and the North Country.
Thank you, Angie. I would like to begin today's presentation with an explanation of LIFEPlan CCO-NY, an Advanced Care Alliance of New York's strategic partnership, and how it has impacted incident management for both organizations. In the fall of 2021, ACA-NY and LIFEPlan CCO formed a strategic partnership and created Coordinated Care Alliance of New York, CCA-NY, a managed service organization led by Chief Executive Officer Nick Capoletti. ACA-NY and LIFEPlan continue to operate as two separate CCOs with unique care management and care connection teams, but now have a shared leadership team and have aligned several support departments. This partnership has allowed both organizations to benefit from the best practices of each CCO and achieve greater operational efficiency, which ultimately strengthens the quality of support and services provided to each member. Incident management is one of the departments that was brought together under one CCA-NY department. Thus, some incident management procedures for both CCOs have been updated and will be discussed in greater detail today. In accordance with the Office for People with Developmental Disabilities, OPWDD, Part 624 and Part 625 regulations, CCOs follow many of the same incident reporting requirements as other agencies providing service under the authority of OPWDD. Therefore, we will be reviewing information today that many of you will be familiar with, but we want to make you aware how incident management requirements apply to the CCOs and the care managers. CCOs are required to develop incident reporting and management processes, which ensure incidents are identified, documented, reported, investigated, reviewed, and monitored. CCOs must also internally track situations and circumstances that are sensitive in nature, reportable by another agency, or otherwise outside of the categories described in Part 624 and 625 regulations. To fulfill these requirements, LIFEPlan and ACA-NY have developed an incident management team, an incident review committee, and extensive training on the incident management process for all CCO employees. In today's presentation, we will discuss the role of each of these entities and the care manager's role. LIFEPlan and ACA-NY use this quote as a frame of reference for all we do to support our members. This is also the first slide in the incident management training that CCOs, employees, including care managers, receive. It reminds all of us at LIFEPlan and ACA-NY that our members are people just like us, and it is critical to treat each of them with dignity and respect. Care managers are encouraged to value each member's choices, even if those choices are not what we might choose. By honoring members' choices and advocating for others to do the same, CCO employees can help prevent members from being abused or neglected. Incident prevention is the focus and goal of all incident management. While all of us here strive to prevent abuse and neglect, we realize that it may still occur. Therefore, like our provider partners, LifePlan and ACA-NY have developed an incident management process with an emphasis on protecting members to the extent possible from harm, ensuring members are free from abuse and neglect, and enhancing the overall quality of a member's services and care. A thorough training on incident management ensures that all CCO employees understand their role in this process. Every LifePlan and ACA-NY employee receives extensive incident management training when they are first hired and at least annually thereafter. This training highlights that the first step in incident management after prevention is recognizing abuse or neglect. Care managers are trained to recognize what constitutes potential abuse or neglect so they can report it immediately and thus ensure the safety of a member. As service providers under the authority of OPWDD, you will no doubt recognize the following list of incident categories which need to be reported. Care managers are not expected to know which of these categories an incident would be defined under when reporting it. Classification of an incident is the responsibility of the CCO's incident management team, and we will talk more about this team later in the presentation. That said, the definition of each incident classification is reviewed thoroughly with the care manager, along with examples of each. This is done to ensure that care managers are able to recognize and thus report all forms of abuse or neglect and other significant incidents. Similar to other staff at provider agencies, LifePlan and ACA-NY care managers are trained to recognize the following as always reportable as an incident. Anytime a member passes away, if a member is arrested, anytime a member makes a homicidal threat, when either Child Protective Services, CPS, Adult Protective Services, APS, or the Administration for Children's Services, ACS, is involved with a member, if at any time a member is involved with law enforcement. Like other entities working under OPWDD, Part 624 incidents for both CCOs are those which occur under the auspices of LifePlan or ACA-NY. Part 625 incidents do not occur under the auspices of the CCOs, so are incidents against a member who resides in the community where the alleged abuser is not a CCO staff member. For LifePlan and ACA-NY, internal incidents are those that do not rise to the level of a reportable incident or have already been reported to OPWDD or the New York State Justice Center by another agency. Therefore, a 624 or 625 incident, which was reported by a service provider, is considered an internal incident for LifePlan and ACA-NY. After recognizing an incident, a care manager's first responsibility is to protect the member from further harm and ensure their safety. This could require a care manager to call 911, help seek medical attention, contact APS, CPS, or ACS, contact law enforcement, or follow up with a service provider. There may be circumstances where abuse is so egregious that a care manager will contact law enforcement even if the member does not wish them to do so. In these cases, the care manager will discuss this with the member and talk about the ways that law enforcement can be notified while still giving the member as much control, choice, and respect as possible. Lastly, as mandated reporters, care managers are expected to report an incident as soon as they discover or even suspect abuse or neglect. To support this process, LifePlan and ACA-NY have developed an incident management team with coverage 24 hours a day, 7 days a week, so that care managers can report incidents immediately. Care managers are also expected to notify the Justice Center of abuse or neglect of a member who is receiving services from a certified setting and can do this before contacting the CCO's incident management team. Care managers are aware that failing to report incidents upon discovery could be considered abuse or neglect on the part of the care manager. If a care manager is unsure if an occurrence would be considered an incident, they are instructed to report it to the incident management team anyway to seek further guidance. To enable care managers to immediately report incidents from anywhere, LifePlan and ACA-NY have developed an online incident reporting form. Care managers can easily access the reporting form on the CCO's internal website or via an app on their phone. The information about the incident requested on the reporting form is listed here. Care managers are trained to submit the incident reporting form as soon as they learn of a potential incident, even if they do not have all of the information listed. However, care managers must provide this information to the incident management team as soon as possible. Therefore, care managers will be asking for the following details when service providers notify them of an incident: the date of the incident or approximate date the incident occurred, what happened, what are the allegations being made, any specific details about the incident, all the immediate safeguards that were implemented to ensure the health and safety of the member. While the care manager will be expected to gather key information about an incident from a service provider, there is some information that service providers will not be expected to share with them. Service providers will not be expected to share the names or any other identifying information of the staff alleged in an incident. Service providers will also not be expected to share the names or any other details that would identify other people receiving services who are involved in the incident, unless the care manager also supports the other people involved. Next, we will talk about the CCO's incident management team, and it is my pleasure to introduce Fran Burnham, LifePlan's Regional Vice President of Care Management for the Greater Mohawk Valley and North Country. Fran?
Thank you, Karen. As mentioned earlier, LifePlan and ACA-NY have developed a joint incident management team with employees who specialize in incident reporting and management. The members of the incident management team have also received advanced training in the reporting requirements of OPWDD Part 624 and 625 regulations, and the requirements of the Willowbrook Permanent Injunction for incidents involving Willowbrook class members. This training enables the CCO management team to support and guide the care managers in the incident reporting process. The incident reporting form, which care managers complete and submit to report an incident, goes directly to the CCO incident management team. Upon receipt of the incident form, the CCO's incident management team immediately reviews the current incident's facts and circumstances. If the team has any questions about the incident report, they will reach out via telephone or email to the care manager who made the report. The care manager is expected to return the phone call or email immediately with all the required information. A member of the CCO incident management team will also contact the care managers via email with any additional paperwork required to be completed. Care managers are expected to complete the forms from incident management on the same day they receive them. Thus, care managers will often follow up with service providers and request additional information regarding an incident be supplied to them within a certain time frame. To ensure sufficient action was taken to safeguard the member from further harm or prevent reoccurrence of the incident management team thoroughly reviews the immediate safeguards implemented in response to the incident. The incident management team will contact the care manager with recommendations for additional actions if the member's initial actions were not taken sufficiently enough to protect the member from further abuse and/or neglect. Appropriate safeguards will vary according to the incident. Care managers are expected to work with service providers to ensure sufficient safeguards are put into place. In some situations, the incident management team may ask the care manager to assist the member's need through either an in-person visit, a telehealth visit, a phone call, or to provide information to connect the member to appropriate supports and services. The incident management team is also responsible for ensuring that the required entities have been notified if a potential incident of abuse or neglect of a member. If the notifications have not been made, the incident management team will follow up with the care manager to do so. Some of the entities that care managers may be directed to contact include 911, other law enforcements, Child or Adult Protective Services, Administration for Children's Services, OPWDD Crisis Team, local mobile crisis teams, New York State Justice Center. For 624 incidents that the CCOs have reported, the incident management team will notify other individuals and entities as part of 624 information as required by Jonathan's Law. Service providers will complete the required Jonathan's Law notifications for any 624 incidents that fall under their auspices. As mandated reporters, care managers are required to notify the Justice Center of potential abuse, neglect, or mistreatment of a member by staff. If applicable, the CCO's incident management team will reach out to the service provider to alert them of this action after the care manager calls the Justice Center. The incident management team will also request the safeguards that will be implemented by the provider if applicable. Should a service provider suspect that there has been potential abuse or neglect of a member by a CCO employee, they should follow their agency's procedures along with reaching out to the CCO's compliance team to make a report. The telephone number for LIFEPlan and ACA NY's compliance department is located on each CCO's website. Providers should not report an allegation involving a care manager to the care manager or their supervisor in order to avoid interfering with any investigations. In all other cases, care managers will be communicating with service providers regarding incidents and follow-up. As mentioned earlier, the CCO's incident management team is responsible for classifying incidents and will do so when reporting the incident. For the CCO 624 and 625 incidents, the incident management team will report both to OPWDD through the IRMA system and be responsible for investigating, reviewing, and follow-up and monitoring. A 624 or 625 incident, which was reported by a service provider, is considered an internal incident for LIFEPlan and ACA NY. So the CCO's incident management team will not report it to OPWDD through the IRMA system. In this case, the service provider will follow its incident management policies to complete the required incident management process. For internal incidents, the care manager is required to notify the CCO's incident management team promptly and to provide the immediate safeguards implemented. To enable the care manager to do this, we ask that all service providers notify care managers of incidents as soon as possible. The LIFEPlan and ACA-NY incident management team includes incident investigators who are responsible for completing the investigation of an assigned incident. Care managers are not only expected to respond to questions and requests from the CCO's investigators, but to communicate with them regularly until the investigator notifies the care manager that the incident is closed. Care managers are expected to fully participate in investigations for all incidents in response to questions from the Justice Center investigators, as well as outside investigators. Once a service provider completes an investigation of an incident, they are expected to inform the care manager of any recommendations that their incident management committee may have or findings of their committees may have concluded. Depending on the recommendations or findings, the care manager may need to provide education to the member, monitor corrective actions taken, up to and including amendment of the LIFEPlan. LIFEPlan and ACA-NY have incident review committees which meet regularly to review incidents and ensure that reportable incidents and notable occurrences were reported, managed, investigated, and documented, consistent with the provisions in OPWDD's 624 regulations. The committee is comprised of people with various and distinct roles within LIFEPlan and ACA-NY, as well as members receiving services and at least one representative of an advocacy organization. In addition to 624 incidents, the Incident Review Committee also reviews 625 incidents, and the internal incident data is used to determine trends of incident types. The Incident Reporting Committee will also make recommendations to improve the protection of members based on its monitoring of reporting of the process and any trend analysis. Recommendations are submitted to the CCO's Chief Executive Officer or designee, who will ensure that the recommendations are considered in the best interest of preventing future occurrences. Working with the incident management team, the Incident Review Committee compiles and reports data on Part 624 and 625 to OPWDD quarterly. At least annually, the Incident Review Committee prepares a report summarizing the incident activity over the course of the past year, which is then shared with LIFEPlan and ACA-NY CEO, leadership team, board, and also OPWDD. As reviewed, the care manager is instrumental in communicating and following up with service providers when managing incidents. However, the incident management team provides the care manager with consistent directions and support throughout the process. We appreciate the many service providers we partner with who provide timely and accurate communication to the care manager regarding incidents. Should service providers need additional support during incident management, they are welcome to contact Glenda Crisp, Director of Corporate Compliance and Incident Management for LIFEPlan and ACA-NY at the email address and telephone number listed here. This concludes the incident management portion of today's presentation. Glenda Crisp, Director of Corporate Compliance and Incident Management, is here to answer any questions that you may have submitted. I will now turn this over to Megan Porter to assist with this.
Thanks, Fran. Okay, so we actually do not have any questions in the chat box at this time. So I'd like to invite our participants, if you would have a question to ask and it's not in the chat box, I would like to invite you to, you feel free to unmute yourself and ask the question outright. It's not a large crowd here. We have about 35 people in attendance. So we should be able to have, a Q&A that way also. I'm still not seeing anybody jumping at the chance. So if we don't have questions, I'm going to turn it over to Nicole Richardson, who is going to give some updates about the LIFEPlan and ACA-NY recertifications with OPWDD. So Nicole is the VP of Care Management at ACA-NY for Brooklyn and Queens, and I will let her take it away from here.
Thank you, Megan. Good afternoon. So during the first quarter of this year, both ACA-NY and LifePlan were visited by OPWDD for their redesignation and recertification review. We are very happy to report that we concluded the review and received excellent feedback from OPWDD. We will not get the final report until later in the summer, but our success last time resulted in a 2-year redesignation certificate. The recertification redesignation process includes an OPWDD team visit and interactive interviews with CCO team members so that they can learn from us and we can learn from them. If OPWDD identified areas that need improvement, the CCOs will be given time to address the concerns identified. Since OPWDD's last visit, LifePlan and ACA-NY have improved the quality of services provided to members and families by regularly monitoring their quality management plans, streamlining policies and procedures, and eliminating potential compliance concerns. As a result, both CCOs expect to achieve the full 2-year certification this time. That concludes today's presentation. As a reminder, the Directors of Provider Relations are available to assist you with any questions and concerns you may have. Coverage areas and contact information for each director is available on the provider page of both CCO's websites. We also encourage you to utilize our respective customer service centers. We hope to see you at our next provider webinar in August. As always, we welcome your suggestions on topics for future provider webinars. Thank you and have a nice evening.